process?
Not in our office either. I'm just trying to pray that my children don't walk in the room. So
the most exciting part of watching TV now is just seeing every newscaster or weather forecast person's homes and bedrooms and living rooms and kitchens these days. Hello everyone, thanks for joining us today. Today my goal is to talk about only a couple of procedures that give you the most impressive result with the shortest downtime. You see, there are procedures that you can do all year long: a tummy tuck, a breast lift, an arm lift. These are procedures with a couple of weeks of downtime. They come with a surgical scar and they need a lot of preparation, right? But there are also procedures that we see a surge in right around summer, springtime. These are the procedures that will make you ready for your summer goals, whether you want to call it a summer body or something that improves your self-confidence in when you get into bathing suit. Most people, when they show more they show more skin in their clothes, they would like minor improvements here and there, and I will try to focus on those procedures today also. Now, on a separate topic, so that's as far as breast augmentation. It's a procedure that requires a couple of days of downtime, and within a few weeks afterwards you're going to have your natural look and the scars are barely visible. The other procedure that's very popular in spring, preparing for the summer body, quote unquote, is a liposuction procedure. Patients always have some sort of body goal before they go out there in summer, and sometimes there's a little bit of fat left here and there that despite all their diet and exercise, they couldn't get rid of it. And that's what liposuction comes into play. And our liposuction is called snapback lipo because we also have a technology that with radio frequency, it can help your skin tighten up. We don't just melt the fat. It's a machine that we do this procedure under local anesthesia. This patient is wide awake. We do the liposuction, and then with this machine, we treat your skin. So as you melt fat and you try to contour your body, your skin also retracts and snaps back into place. Why? Because after a certain age, let's say 40, 45, your skin loses some elasticity. So I always tell my patients, prior to having this technology, there is a small chance that you might have a little skin laxity after the procedure. But now with this technology, it's like an insurance policy that we're going to melt your fat and we know that your skin is going to tighten up afterwards to follow the contour of your abdomen. Some examples of liposuction. Now, this patient wanted liposuction and a buttocks augmentation. She went from a size 4 to a size 6, but we liposuction her abdomen and her back, and you can see the curvature that now she has and the improvement. This is a 1-year follow-up, and you can see the amount of fat retention that she's had. We can do this to anywhere in your body. It's not limited to the abdomen. If behind the neck, sometimes patients have a fat pocket, we can melt the fat and tighten the skin. Are done under local anesthesia. These patients did not go under general anesthesia, and you can see the improvement in the flank. Now, this is a different type of patient. As you can see, fat is not her problem. This is a very one of my patients who's a bodybuilder. She has an Instagram account and a lot of followers, and she noticed that in certain lightings now, after a certain age, let's say over 40, she sees wrinkles that she didn't see before. Now, She doesn't need a tummy tuck. She doesn't have that much excess skin. You couldn't even do a tummy tuck on her if you wanted to. In her case, we just did the radio frequency part of our procedure, and you can see 6 months later, it makes your skin tighter and it helps your skin retract and stick down to your muscle so it's less loose. You can see the improvement in the upper part of her abdomen. As I said, anywhere that you have fat and skin, we can do this procedure, right? You can see what we call the bra rolls. This patient got the entire back liposuction and we did the radio frequency procedure, and you can see the complete obliteration of the back rolls and bra rolls in her. Another patient that doesn't have any fat problem, she has extra skin. Probably a few years ago, she needed a mini tummy tuck. Now we did the radio frequency procedure on her, and this is her 6 months after. A very good example of someone that wanted to get ready for her summer body. I can't believe it's been a year from that procedure, and you can see the result without any surgical scar, without any downtime. She was with the whole procedure. Now, there are patients that really need a tummy tuck, but they don't want to have a tummy tuck, right? Now we have a procedure that we can make it tighter without giving them the scar. The results are not going to be identical, but these patients don't want to have a scar. Now, another example of someone that at the first glance you might think she needs liposuction because you see this area. But what she really complains about is the wrinkles underneath her belly button. And it's the extra skin that after pregnancy, when her body was going back to normal, it just didn't get rid of all the wrinkles. We did the snapback lipo. Not only we fixed this area, but we also removed the wrinkles here, and you can see the tightness that she has. Now she still has some mild stretch marks, as you can see, but she didn't want to have lipo. She didn't want to have a tummy tuck, and she just wanted this horizontal lines improved. And now we have a technology that we can do that. Same thing with arms. We talked about abdomen, we talked about the neck and back, and the same procedure applies to arms. Patient is wide awake during this procedure. We inject numbing medication, and then with liposuction, we're going to suck some fat and then do the radio frequency procedure. And this is the type of results one can expect from this procedure. It's not an arm lift, but the scars that an arm lift would give you. Another patient with bra roll improvement, her thing was bra roll and her arm. We frequently combine the two. Now, as far as recovery from liposuction, it's also not major. There's no real restrictions in lifting because we're not cutting anything. We're putting a very small hole for the cannula to go in your skin. So as far as lifting heavy objects, lifting the baby, there's no restriction as long as it doesn't hurt. And usually patients don't really need much medication for more than 2 or 3 days. You're going to feel achy. You feel like somebody punched you in your abdomen or punched you in your arm, and it's achy for a few days. The main thing with the recovery from liposuction and snapback lipo is the commitment that you have to give me to wear your compression garment for a good 6 weeks. The compression garment does a few things. Helps the swelling and the edema to go away by squeezing your skin. Also helps the skin to retract and stick down where you want it rather than getting wrinkly on your muscle. And majority of people, they say it feels good after a few weeks. When they start using it, they get used to it and they call me and say, can I continue using it? Because when I work out, I like the fact that I have compression, whether it's on my arm or in my abdomen. As far as results, by the end of the first month, when majority of your swelling goes away, you're going to start appreciating the result. You will see it. But the results are not going to be final for a good 3 to 6 months because there is going to be some residual swelling that's going to be there for a good 3 months, and then the skin tightening portion usually lags behind. It takes about 3 to 6 months for new collagen to be made, for your skin retraction to happen. But as far as debulking and losing the fat, you're going to start digging the result by the end of the first month.